This is Dr. Cynthia Steinbley. I'm a cardiothoracic and vascular surgeon in Elgin, Illinois, in the Chicago suburbs. I've been asked to present some information regarding our advocacy priority for this year, which is to reauthorize the Patient-Centered Outcomes Research Institute, or PCORI. One of the 2019 STS advocacy priorities is the reauthorization of the Patient-Centered Outcomes Research Institute, or PCORI. For this ask, our message is simple. Ask that your members of Congress support reauthorization. PCORI is a nonprofit organization authorized by Congress to fund comparative effectiveness research, or CER, research that compares two or more healthcare options to determine what works best for whom and under what circumstances. The studies are designed to produce useful information that will help patients, caregivers, clinicians, employers, insurers, policymakers, and other stakeholders make better informed decisions. As you can see here, they focus on underserved populations and complicated conditions. When you take meetings on the Hill, you may be asked why we need PCORI, especially when we already have the National Institutes of Health and the Agency for Healthcare Research and Quality. Traditional research does not always address the questions patients face daily about which unique care approaches work best for them, such as which treatment option will help me meet my personal goals and allow me to continue doing the things that matter most to me. Many PCORI research projects seek to answer questions like this, as well as to empower patients to make informed decisions about their treatment options. PCORI is the only organization dedicated to funding such studies. Another crucial difference is PCORI's patient-centeredness. PCORI is the only research agency that requires its contracted researchers to engage patients throughout the research process. Comparative effectiveness research without patient-centeredness can result in guidance that discriminates against certain patient populations and patients with complex conditions. There are several key features of PCORI-funded research. It compares at least two alternative healthcare options, focuses on outcomes that are meaningful to patients, engages patients and other stakeholders at every stage, studies benefits and harms of care delivered in real-world settings, and is likely to improve current clinical practice. PCORI invests in studies that benefit cardiothoracic surgery patients and providers. Heart disease and strokes cost a lot of money, $320 billion in healthcare costs and lost economic productivity in 2011, according to the U.S. Department of Health and Human Services. PCORI has invested $301 million to fund comparative effectiveness research studies related to cardiovascular disease. For example, PCORNet, the National Patient-Centered Clinical Research Network, will enable us to learn from the data and experiences of 100 million Americans. It is building capacity for research and other studies by supporting patient-driven networks and helping them connect with researchers who are studying similar topics, including cardiovascular disease. 6 PCORNet partner networks have cardiovascular health as a primary focus, including the Health E-Heart Alliance. The first randomized controlled trial to use PCORNet's resources, Adaptable, is comparing the benefits and risks of 2 doses of aspirin prescribed to patients with heart disease. Funding PCORI is an ask this year because its funding stream is due to expire this September. PCORI is funded through the Patient-Centered Outcomes Research Trust Fund, or PCOR Trust Fund, which Congress established through the Affordable Care Act in 2010. There are 3 funding streams that supply the PCOR Trust Fund: appropriations from the General Fund of the Treasury, transfers from the CMS trust funds, and a fee on private insurance and self-insured health plans. The PCOR fee is adjusted for increases in healthcare spending, and as of 2019, it is $2.45 per covered person. PCORI receives 80% of the monies collected by the PCOR Trust Fund to support its research funding and operations. HHS receives the other 20% of trust fund money to support dissemination and research capacity building efforts, the majority of which goes to the Agency for Healthcare Research and Quality. When you are in your meetings, you may be asked how much money we're looking for to fund PCORI. Because this is a reauthorization request and not an appropriations ask, we're not requesting a specific sum at this time. However, PCORI is currently funded at $150 million per year. STS staff will be happy to follow up with your congressional offices when we come to the appropriations process. Here you can see some common questions from opponents of PCORI, such as, isn't PCORI duplicative of research already being done by the National Institutes of Health? Shouldn't private companies do this research instead of the government? How do we know PCORI-funded research is actually useful in the real world? Your briefing arguments will dive into these questions with examples and data to help you counter arguments against reauthorizing PCORI. Research is a long-term endeavor, and some high-quality CER studies can take 4 to 5 years to complete. Even after the completion of these studies, additional time is needed to develop and implement clinical decision support and shared decision-making tools. For the ongoing investment in PCORI-funded research to be most impactful, stability in PCORI funding is imperative to allow ample time to conclude studies, disseminate the findings, develop implementation tools, and drive implementation where appropriate. Reaffirming the commitment to PCORI for another 10 years will allow the Institute to build on its success in changing the culture of research to be more patient-centered and to enhance its work in partnership with the other agencies and stakeholders to support a sustainable infrastructure for disseminating and implementing research outcomes meaningfully into practice. PCORI's current authorization will expire September 30th, 2019. At that point, PCORI will no longer have the authority to commit to new research grants, and only previously awarded grants will continue to be funded. PCORI's research commitments are expected to support research expenses through 2023, while funding for new research commitments and infrastructure will lapse without congressional action. Congress can reauthorize PCORI so that it can continue funding critical, patient-centered CER and improving the healthcare system for all. Please ask your legislators to support reauthorization.